So this was a 75-year-old female who basically had a history of arthritis and hypertension. And her daughter was very concerned because she had started isolating herself at home. She had been a pretty social woman. Her husband had passed. All her adult children had gone their own way. Just the daughter lived nearby. The others had scattered across the country, which is not untypical with families these days. And the daughter came in concerned that she said, you know, Mom is just not being herself. She's staying at home. She's gotten hooked on this online gambling. She's also playing all these cash games on her phone. And she's been calling me all this time, it seems like every day, complaining that she's really nervous, she's really anxious, that she's in pain, that she's having to make these visits to the urgent care because she doesn't feel like her doctor's doing what he's supposed to do. And this was not her mom. Her mom was usually very involved with family activities, very social, had a group of friends that she was going out with, could drive herself to places, and suddenly all this was changing pretty rapidly. Basic background was that she had divorced early on in the marriage and raised most of the kids herself. She had come from a strict fundamental Christian background. She was primarily a housewife, although she did do some work outside of the home once she divorced her husband, and she did get money from the divorce, plus she came from a very wealthy family herself. So that kind of helped that she could stay home and take care of her children. And basically, she really considered her daughter her only child because the other two siblings were her husband's children, and they sort of went their way with him. So it was pretty much just the focus of her and her daughter. So let's look first at some statistics. Personality disorders, we know, can happen at any age. However, in older adults, they comprise about 15% of all psychiatric diagnoses. So that's not a whole lot. So it might be something that we overlook, unless you're a psychiatric provider who is specifically looking for these things. So it's not something we keep in the back of our mind that this person who's having difficulties, because as you could see, some of the things that I've already talked about with this woman, we're thinking, well, is this something physical? Is this early signs of dementia? What is this? And we're also seeing that about 10.6 to 14.5 are in the community. And interestingly enough, 57.8 are in skilled nursing facilities. Aha. So those of you who are working in skilled nursing, maybe some of those things that are going on are not dementia-related behavior. They could be an underlying personality disorder. There is a DSM-5 definition, which is an enduring pattern of inner experience and behavior that deviates from the expectations of the individual and culture. So we are saying that these people are acting differently than a normal individual would of their age and their background. And it affects many different areas. Well, when you think of a personality disorder or any type of psychiatric disorder, you think, oh, well, it's going to affect their mental status maybe and their personality. But we know that it can affect cognition, it can affect their affectivity, how they present to others, their impulse control in some cases, and their interpersonal functioning, how well they can get along with others. And you're starting to see some of the little clues we've had already that pretty much she's hitting all four categories here. So what are the manifestations? What are the things we need to be looking out for? Well, is there any type of pervasive or inflexible presentations? Do they just seem to be the same way all the time? Do they get obsessive about certain things? Do they develop certain habits? Do they have a certain way of interacting with people? And is there a significant distress or impairment because of that to their social functioning, and if they're still working, their ability to maintain their job? Interestingly enough, this is something that is long duration, but it may not be picked up in the earlier middle stages. A lot of times these folks were just considered a little different, And then suddenly, once we see them as older adults and things aren't quite right, and we do a little bit more digging, we realize, they may have had this most of their adult life, but it was just put away as, oh, okay, he's just a little different than the other person. And those are clues that we need to look for. That is the main part of assessment here with personality disorders in older adults, because if it hasn't been diagnosed earlier, then we're going to have to start digging back through, talking with the patient themselves, talking with family, others that have had close contact with them, to find out what were they like when they were a younger adult, a middle adult. How did they interact with people? Did they have trouble on their job? Did they have other kinds of issues? Did they have certain kinds of obsessions or compulsions? What was going on that could have been a clue early on that got misplaced? Excuse me. What is it not? Okay. Personality disorder is not a consequence of another mental disorder. It functions by itself. We know that people can have like depression and anxiety together. Okay. You can have social anxiety and other conditions that go along with other things, but personality disorder stands alone by itself, so it's not attached to another mental disorder. And it can be attributable to the effects of substance abuse. A lot of people with personality disorder sometimes are considered the party person. They're the ones that are out there being different and doing things and having a whole social group of friends around them because they are that unique kind of person, and that may lead them down the road to some type of substance abuse, whether it's alcohol or drugs. And it is not a medical condition, obviously. It's strictly a psychiatric condition. So what are those influences? What are the things that we're going to need to tweak out to find out if this is truly what it is? Well, we want to take a deep dive into what are their character traits? What makes this person the person that they are now and the person that they were before? And were there any major life events or experiences that may have actually exacerbated that, or led to the fact that this may have been very subtle and continued to grow and get bigger as the person got older? And then just the normal stress from aging. None of us really want to get much older, do we? And especially what we all here knowing what happens as we age, both physically and mentally. You know, you start to think about, okay, just the stress of, I've been this wonderful crazy individual who's had all these friends and has been very active and has had this wonderful quirky life, and now my physical body or my mental condition, or with my friends dying, with me aging, I'm not able to do that anymore. So if we're looking too at the lifespan perspective, we know that very early on in life we develop certain mechanisms to help us cope with stress, to help us cope with adversity and change. So how did this person do that in the past? Were they one who just pulled up their bootstraps and went along with life? Or were they someone who became the shrinking violet and needed help and just curled up in a ball? Did they use other things to cope? Did they seek medication? Did they seek treatment? Did they start with substance abuse? And how did their social role help them in the past? Were they the life of the party? Were they the person who was able to take charge? Were they the person that enjoyed what they were doing and wanted to bring others into that life with them? And so now, how's aging changed their social role? Have they lost friends? Have they lost contacts? Have they been separated from close family members, children and grandchildren? Are they self-isolating because they don't want to be seen in the condition that they're in now? All those things have to be taken into account. And interestingly enough, a lot can be traced back to unmet needs, as far back as childhood or in early adulthood, those formative years. What in their background and upbringing could have triggered this?